Welcome to the virtual listening session held by members of the Board of County Commissioners. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll coordinate the public comments for today's meeting. If any attendees would like to provide a comment or ask a question, you will be prompted to do so in a few minutes by me by utilizing your raise hand feature on Zoom. Your raise hand button is on the Zoom bar. That's at the top or bottom, depending on your device. If you're on the phone, and I see we do have some phone listeners with us today, you can also hit *9, and that lets me know that you have a comment or a question to ask. Today's topic is the Intergovernmental COVID-19 response, or the response to the pandemic. With us today, we have Clackamas County Chair Jim Bernard, Clackamas County Vice Chair Martha Schrader, Clackamas County Government Affairs Manager Chris Lyons, State Representative Andrea Salinas from Lake Oswego, State Representative Christine Drazen from Canby, and Dan Marr from the Office of Senator Jeff Merkley. The session will be archived later, and a corresponding Q&A document will be produced. And with that, I'm going to turn it over to Chair Bernard to give some opening comments.
Thank you for joining us today during this ongoing pandemic and its overwhelming effect on the waves of our lives. The Board of County Commissioners has prioritized staying directly connected with our residents and stakeholders. We've held 3 virtual listening sessions, and we continue to see a lot of public participation. Clackamas County Commissioners are doing this to stay as connected as possible with the residents and our customers. Today's topic is intergovernmental response to COVID-19, especially how the local, state, and federal government are working together to respond to the pandemic. Clackamas County Commissioners continually meet with regional counterparts and our state and federal contacts, through which we have lots of influence, we think. We need to know what could we be doing better from the regional perspective. How can commissioners better advocate for our community so that it thrives in the short and long term? We want to hear directly from you all, your opinions, your experiences during this pandemic, and thoughts of how we can do it better. We're then going to take what we hear to the full Board of County Commissioners as we take action to help our communities. And with that, I'll pass it on to Vice Chair Martha Schrader.
So I just went off mute because I'm going to warn everybody, I have 2 dogs here and they bark. So barking dogs, Jim, it's Jim's favorite thing. In any case, thank you all for being here. This has been really an unprecedented time, I think, not only in our county, but nationally in history. Last time we faced anything like this evidently was in 1918. And I think that Clackamas County is rising to the challenge. I think that we were the first folks to declare an emergency. I'm glad that, frankly, we saw the reason to shut down quickly, to do physical distancing. I think that our county has done a lot of things right, because at this point, I believe in the Tri-County area, we have, and Jim, you can correct me, 97 cases and 3 deaths. That's pretty good for a population of 400,000, but we need to know from you what we can do better. We need to know what the needs are. I believe our business community is suffering. We need to know what to do to help them and help funnel federal dollars directly to those businesses that need it. And more importantly, we need to come up with a notion of when this dies down, how do we work towards recovery together? That's going to be key. So thank you for being here. I want to thank Andrea and Christine, our representatives, for being here today and for helping us with this. So I'm going to hand it over to you, Jim.
You guys want to say anything? Andrea or Christine?
I'll let the minority leader go first. Oh, thank you. I just want to quickly say that the conversation we're having now with the public to have this listening session is so important. And I also want to note that this pandemic needs to be and has been responded to comprehensively across all levels of government. And our county partners really are true partners in this work. They're on the ground, they know where the need is. And so I am really excited to be here today and hear what folks have to say, and also to continue to partner with the county on this work. So thank you for the opportunity.
Thank you. Andrea?
Yeah, thank you, Chair Bernard, and thank you, Commissioner Schrader, for inviting me today. So I serve as the chair of the House Healthcare Committee, and I have been obviously very involved in kind of what the healthcare response has been from the state level, from OHA, as well as trying to figure out if there's anything that the legislature can do around this. So I talk to people all the time, but I agree with Representative Drazen. This is a response at all levels of government. And so I have more recently been more engaged with my county commissioners and my local councils. So it is really refreshing to hear really from people on the ground. I look forward to this conversation today. So thank you.
Great. Dylan, do we have some questions?
Yes, we do. I didn't know if Dan Marr wanted to introduce himself as well.
You guys want to say something? Dan?
Sure. Thanks, Chair Bernard. I just want to say, on behalf of Senator Merkley and our office, thanks for having us in on this conversation. And, we're all working together at our levels of government to craft a response to this thing. And really appreciate the partnership we have with folks at the state and at Clackamas County. Our role federally is really help solve problems here in the state and craft these big federal response packages. Most recently passed the CARES Act, which is the $2.2 trillion package that extended and expanded unemployment insurance, authorized direct payments to folks, small business programs to help them stay afloat. And so a lot of our work these days is both looking forward to the next stimulus package to improve on the third package we just passed, but also help stand up those programs authorized by the CARES Act. Most notably, there's been a lot of talk in the media about the Paycheck Protection Program for small businesses, questions about unemployment insurance. I'll just put in a plug for Senator Merkley's website. Our staff is working to keep updated information on the site, easily downloadable, about each of these different pieces of the federal response. So if you have questions, you can go to Senator Merkley's website and get good information. And actually, just in the last couple hours, we uploaded a list of lenders. So if you know small business folks who are looking to access the Paycheck Protection Program, we have a running list of lenders who are accepting new customers. So a lot of good information on the website. Thanks for having us. Happy to answer any questions.
Thank you. Chris?
Yeah, and I'll chime in, round things out to say, we have a fantastic set of representatives who are committed and respond to county's needs. We, as you can tell on this call, we have a great working relationship with our federal delegation and our state delegation. Senators Wyden and Merkley, Representatives Schrader and Blumenauer, we are coordinating with them on a frequent basis. The county also has federal lobbyists that are our boots on the ground back in DC. And then at the state level, we also have state lobbyists who are working in Salem on behalf of the county with the 21 members of our state delegation. We're fortunate to have 2 of them on today, who recently our state legislators recently established a Clackamas caucus to advocate on our behalf, and they're doing an awesome job moving forward with that. And lastly, I'll say, in addition to the federal and state work, we're also doing at the regional levels. We have a very close working relationship with Multnomah and Washington counties. Chair Bernard has frequent meetings with his fellow county chairs in both of those counties, and we work frequently with Metro. And then within Clackamas County, we are constantly coordinating with our many cities. Chair Bernard has meetings with all of the mayors on a frequent basis, coordinating committee with all of our cities and other entities. So we are constantly working in across all levels of government for the residents of Clackamas County. So thanks so much for tuning in, and I look forward to hearing from you.
Great, thank you very much.
Okay.
Go ahead, Dylan.
Okay, great. So attendees, if you are out there and you would like to go ahead and provide a comment or ask a question, you can go ahead and do it now by utilizing the raise hand feature on Zoom. Your raise hand button is on the Zoom bar, and that's at the top or bottom, depending on your device. If you're on the phone, I see we do have some phone listeners. You can also hit *9, and then that will let me know that you want to raise a question, or you want to ask a question or make a comment. So anytime for those. I'm going to start with an email because we have been getting some emails in about the listening session from people who have not joined or could not join us right now. First is from Joe in Milwaukee, and she writes, I've been furloughed for 2 weeks so far and cannot get through to unemployment by phone or website. I live month to month and I'm not going to be able to pay my bills. I did actually connect one day about a week ago and was on hold for several hours, and it just up and disconnected all of a sudden. I tried on Sunday to get through to a recording, and it asked for my name and social security number to start my claim, but I still needed to call back. I've applied for work, but nothing yet. If I do finally get through, it's a 1 week wait for a check, even pushing me further into poverty. I am frustrated and a little scared. If there's anything to do to help this process, please help. So if we want to start with that, does anybody want to talk about that one?
Well, I'd say we know the issue, and I'm sure these two folks are working hard at resolving that. That's really all we can say. There's a lot of people filing, and the lines are huge, and we weren't ready for this, and I know they're building on it. So you guys want to say something? See here.
Oh,
I can jump in really briefly. I checked in with the governor's office about this again today. We were on a call yesterday with the White House, and at a federal level, there's assistance for the states who are having trouble with technology for processing unemployment claims. And the governor's office was going to look into whether or not Oregon was going to pursue some of that additional assistance. But in the meantime, here's what, I'm just going to read it out from the governor's office. It says, if folks are having trouble getting through, there is the email that people should send something to. And right now, the reason that they are not making other technology changes is because they are focusing on getting the $600 payments out the door as quickly as possible. So they are at this moment avoiding making additional technology changes until they have resolved that issue. If people are starting through the process, their claims, as I understand it, are still being processed even if they get error messages. And so there are, as Chair Bernard mentioned, the system is absolutely overwhelmed. The unemployment division is working really hard and fast to hire as many as 400 new folks to support the processing of these claims. And they're working really hard every day to improve turnaround and improve responsiveness to this. But for the person who sent in this message, I would encourage them to reach out to their own state legislator and see if there's anything that they can do to continue to provide them assistance and support. Because the last thing we want is people who are stressed right now financially to have this feeling of despair, like people don't see them and like there's not an end in sight. We're here at every level of government to make sure that doesn't happen. And so the system's absolutely burdened right now, but we want to be sure that you know that we're here to help you navigate that. So thank you.
Thank you much for that. Yep. Go ahead, Representative Salinas.
I'm sorry, I had raised my hand, but I don't really, Representative Drazen was very thorough in her response. She's right. I think the best thing to do would be to, if you still are not hearing back, to just contact your representative. And there are many different venues in which to get questions answered. So, but the employment department is seeing unprecedented numbers of unemployment insurance claims. So they are really burdened right now, but they are working to turn that around. That is right. So.
Okay, thanks very much. So again, if anybody of all of our attendees, if you have a question, then please go ahead and hit the raise hand feature on Zoom. That's in your Zoom bar, or if you're on the phone, *9. The next question that we got was from Pam in West Lynn. who says that a lot of states are reporting their coronavirus cases by county and by zip code. Why can't Oregon include zip code reporting for the COVID cases to the general public? Zip code reporting does not impede patient confidentiality, but allows for better informed reporting. Thank you again from Pam in West Lynn. Yep, Representative.
Sure, I'll try to take a crack at this. You know, every state is different. When we first realized that this was eventually going to be a pandemic, this was back in February, and OHA came to me, we started hearing about different cases and about how different states were responding and how they were reacting. And one of them that kept coming to our attention was New York. Why aren't we responding in the same way that New York is responding? So, and what I kept hearing from OHA, and they are right, we are not New York, and we're certainly, you know, Portland is not New York City. So I think every state does have its own way of responding. I think you're probably right in terms of the zip code. I don't think it would be a problem to do it by zip code, but OHA and the epidemiologist, Dr. Seidlinger, have, you know, chosen the way that they're reporting right now, that they believe that it's the best way for Oregonians. It doesn't mean that I would probably put that question to OHA, and we have a call with them every day at 3 o'clock. I'd be happy to ask why we're not doing it by zip code. But yeah, but I think the response right now is either they haven't thought about it or they thought about it and it wasn't something they thought was needed.
Thank you.
Okay, great. Thanks very much. Again, any attendee that we have, and we have quite a few, you can go ahead and hit your raise hand button to ask a question at any time. If you're on the phone, it is *9. I'll also relay a question that we've been getting a lot over the past week, and essentially it boils down to what is the plan for the Oregon short session as far as its priorities with what are going to be addressed with the pandemic? Will it focus on business or addressing unemployment, or what? I guess that's the best way to paraphrase that email. Yeah, Representative Salinas, go ahead.
So thank you. So I have served on the Joint Special Committee on Coronavirus Response, and it was a good group of folks from both chambers, the Senate and the House, and it was a bipartisan group of folks who came together really to look at things, policy changes that we could make at the state level that could be implemented immediately, that would not duplicate efforts at the federal level, and that could really address immediate needs of folks on the ground, and likely without too big of budget implications, mostly because we knew that the federal government was going to have several different packages, policy packages coming forward with, you know, as we saw, over $2 trillion in funding. So we left it up to our co-chairs to kind of come up with some policy proposals, and most of them were really around, you know, keeping people at home and in place, and trying to avoid evictions, both commercial and residential. And even though we knew that the governor's executive orders had addressed some of that, we thought there could be some policy changes that would apply to maybe partial payments of rent and that sort of thing. And so to not penalize people who are really trying to make an effort to, you know, pay their rent or their leases on time and that sort of thing. There were also a few technical pieces so that folks would not get see balance billing if they needed to go out of network and maybe not see the provider they normally see, knowing that this is a big healthcare crisis right now. So there were some nuanced things that I think the committee came together on. And as far as I have heard, it was also kind of vetted so that we made sure that all, and Minority Leader Drazen can chime in, but you know, that we were supposed to get all caucuses on board with this. So, but then we since learned just recently that the governor didn't have plans to call us in immediately. I've been pretty vocal that I think doing something is better, even if it's small right now, is better than doing nothing. So I will be curious to learn when she thinks the right time is.
Go ahead, Representative Drazen.
Thank you, Dylan. I will, I'll affirm what Representative Salinas has kind of run through, that we did have a thorough public process. that was bipartisan and bicameral to allow the state to take in feedback from the healthcare community and the business community and families and advocates and get a sense of where the immediate need was. Since that time, as Representative Salinas mentioned, the governor has made the decision not to call the legislature in. And so a lot of those recommendations were time sensitive, where the vetting that occurred said, what are our immediate priorities, with the hope that the governor would call us in by the end of March. And the decision was made to defer and wait and see what happened on the federal stimulus. And that was an aggressive stimulus, and the rules are still, it sounds like, being kind of handed down, the guidance for where the flexibility might be for the state in those dollars. And it will be, it sounds like, substantial support for families and businesses and governments through those stimulus dollars, which means, as I understand it, not to speak on behalf of the executive, but that the intention at this point is to wait and call us in after that has all been vetted more clearly, and also after we have our May forecast. Our May forecast tells us how deep the dip is for the unemployment numbers and expected revenues coming into the state, and at what level we need to, rebalance our budgets potentially. And so waiting until after the May forecast allows for some of those questions to be answered. And in the meantime, the approach, which was an immediate kind of surgical, careful approach to what we should do as a state, I think that we will support those measures that were brought forward by the committee, but there's not clarity yet whether or not we will open back up the committee process and say, now that we're kind of in a different time frame, now that we know more about the federal package, is there more we should consider doing, or should we tweak the initial recommendations? So I think that the governor has indicated that we're on a slower pace for the legislature to come in. I do think that we will have a role to play to fill in the gaps, and I think it's an essential role. We just need to have a little bit more time to determine exactly what needs to go into that session at this point.
Thank you.
Yes. Great. Okay, we have another question just offline, although I will go ahead and mention again, if any participant, and we do have a decent amount, which is not asking questions or raising the hand on Zoom, you are welcome to raise your hand at any time, or if you're on the phone, you can go ahead and hit *9, and it lets us know that you want to make a comment or ask a question. But as long as we don't have that, I will keep going to the offline questions. On a federal level, what are the main takeaways from the CARES Act, and what can we expect in the future here in the county? So I think it's pretty much directly asking what the takeaway is from CARES Act for the county residents and what county residents can expect in the future.
Mm-hmm. Sure. Thanks, Dylan. I can take that. Overall, our office and Senator Merkley we're happy with a lot of what went into the CARES Act. I think it did a good job balancing all the priorities between individuals, state and local governments, health systems, small business, kind of through the legislative back and forth. I feel like both sides of the aisle, got a lot of their priorities into that. The challenge since then has really just been the agencies standing up these programs, and that's where there's been a lot of frustration. Like the Paycheck Protection Program, that provides their loans, convertible loans, to small businesses who can apply, and to help cover their payroll, their business expenses, commercial leases, and such. And so, a number of small businesses are struggling now and have been working on, getting access to this money, but it's just taken a long time for the Small Business Administration to set up the rules, to get the lenders in place and get them the information that they need. Once the lenders are set up, they then have to triage, because as these big bubbles are working their way through the system, there are just a lot of log jams, and it's frustrating that the agencies weren't able to clear up some of those blockages faster than they have. So as we look ahead to the fourth relief package, and then the work that happens between now and then, there's extra emphasis put on the Fed's issuing better guidance so that, when this money is moving, states and county governments can have a lot more flexibility in how they spend that money. A lot of the state and local support that was in the CARES Act, was designated for coronavirus response. Our office thinks that should be a little bit more flexible because, counties are losing revenue, and that's impacting their essential services that, may or may not be related to coronavirus response, but is still, foundational. So I think with the fourth package, that's where a lot of the emphasis is going to be put. And then also on recapitalizing some of these programs. I think the small business support, the money, once the banks are able to get it out, is going to go pretty fast. And the same thing with, with unemployment insurance, et cetera.
Okay, great. Oh, we had somebody's hand just go up, but they lowered it for a second. Okay. Well, you can still go ahead and hit the raise hand feature if you'd like to ask a comment, but I will still go to the questions that we've got. Oh, there we go. The person came back. So let me bring in Tessa Donnell. I apologize if I'm saying that incorrectly. Tessa Donnell. If you could unmute yourself, and you are on.
Hi, can you hear me?
Yes, go right ahead.
Oh, perfect. So I just want to emphasize, Dan, I'm a commercial banker, and the Paycheck Protection Program, I'm actively processing those for clients right now. Just since you're on this forum, I would encourage you to emphasize that the EIDL, in addition to the Paycheck Protection Program, can be applied for. Although the PPP is going a little bit slower for fundings, the EIDL should, that's up to 10,000 right away. So I would just second what you said and add that in as well.
Thank you.
Great point. Thanks, Tessa.
You're welcome.
So can I pile
Yes.
on that for just 1 second?
Of course.
As I understand it, some of the issues that have come forward from my constituents have had concerns about the EIDL. I mean, hopes were so high that the $10,000 immediate grant was going to be available. And as I understand it, they received more than 3 million applications for that program, and that it's now been reduced. I would hope that in whatever the fourth stimulus is, that there will be a chance to rebuild that program. So right now, if it's only at $1,000 per employee eligible, that is a much leaner amount of support for small businesses. So I don't know if the $250 billion that was under discussion to build back up the PPP is still under discussion, but I would also hope that the EIDL itself could be rebuilt, because there's so much need out there right now.
Yep, excellent point. And yeah, folks are probably seeing in the news today that there are discussions going on in the Senate on kind of how these next packages are going to roll out, whether we're going to go from the CARES Act to like the big fourth stimulus, or whether there will be something in between. And that's kind of the recapitalization conversations here. And so, our hope is that if we do take that intermediate step between the two big packages and pump more money into those programs, that it also comes with some tweaks to how they're rolling out, and also, if we are adding more money to those programs, do the same to the state and local government support as well, because that money is going to go quickly too.
All right, thank you both for that, and thank you, Tessa, very much for calling in. Okay, back to, again, you can hit the raise hand feature on Zoom, or if you're on the phone, *9. Next, another question over email. Nonprofits are the forgotten ones. How are counties working with them? What about schools? Is there relief expected for schools? And how will the state and feds address being online? So I can go ahead and I believe what the question is, at least the second part of it is there any state or federal plans in terms of internet access? Because I know that's been a concern recently.
Well, I can answer something on the county side.
All right.
We're in discussions right now about, our interest in providing high-speed internet throughout the county. We have areas that they do not have that. And we discussed it this week in a very challenging meeting. And next week we will be making a decision whether to go forward or not. We do not have the finances to go county-wide quickly. That would require federal or state dollars. And I expect the state monies are challenged already. So we may have to start slowly. We're looking at a pilot project in an area, I think it's on Colorado is the road or something, that we're looking at doing that. But we're very interested in providing high-speed internet throughout the county. We've been waiting, in some cases, 20 years for companies to provide that service at a reasonable rate. So I'm hoping that we'll make that decision, that the federal government will help us light up the county with our own ISP. And it's a great utility, and the competition isn't competing, they're just not doing. So that's something we're looking at doing.
I would like to add, it's a little more nuanced than that. For example, we do have smaller providers out there. And one of the things the county did in the last stimulus package is do a dark fiber network. And we've been working with the smaller providers to get on that highway so we can help leverage their ability to supply high-speed internet to the rural areas and those unserved areas that don't have it yet. So whether or not the county becomes an ISP is one decision, but another opportunity is to work with the infrastructure we already have and see if with the smaller providers, if our connectivity can really actually do that. And this is not just a local Clackamas County issue, this is a national problem. And the National Association of Counties has worked very diligently with their Rural Action Caucus to take a look at what it would take to get high-speed internet into underserved areas. So as we move forward with this, my hope is that we take a look at some of the models that have been worked nationally, whether it be us doing an ISP or a public-private partnership, I think is going to be the question as we move forward.
So I'm just going to add to that a little bit. I reached out to John Huffman, who's the rural development folks for the state director for Oregon, and asked a little bit about this question. And how are we going to get the money to provide broadband? What's the requirement, match? Where are we at here? And he said there's billions of federal dollars available right now for rural broadband. Most of those programs have a 15 to 25% match requirement. As I understand it, the CARE Act also provides funding for education. And I personally am hopeful that on the state side, that some of those dollars can serve as the match that's needed to expand broadband. I think it's absolutely essential once we've gone to distance learning for the rest of the year that we provide equity and that we do what we have to when it comes to investments in with one-time funds, which is the CARE Act, one-time funds, for this one-time need, which is to really invest deeply in access.
All right, thank you all very much. Again, if there's no raise hands or phone call-ins as far as individuals who want to ask a question by hitting *9, we'll probably wrap up in about 10 minutes here because I've got a couple more questions that we have just offline. One is this pandemic. Oh, you know what? We just had a hand go up, so I'll just go ahead and bring that person in. Okay, the person who I'm calling on is a phone number and the last 3 digits are 709. So if you're that person, go ahead.
Thank you. This is Kathy Heisey. I'm a counselor for the city of Milwaukee. And thank you for having these calls. I'm finding them very useful. I'm calling today because I noticed that you have closed the parks for the county, but have left NCPRD's parks open. I'm curious about why you're treating the two systems differently and what you will be doing to address our concerns about overcrowding and public safety in our parks, particularly since these are the more urban parks. On a day like today, I can tell you personally that we are seeing large crowds of people at the entrances and are worried about being able to protect our residents from situations where they may be subjected to something we don't want them subjected to. Thanks.
I thought we had closed the parks. I'm almost positive we have, but I'll check. I'm texting somebody right now.
You have closed the county parks. NCPRD parks remain open. So all of the parks in Milwaukee remain open.
Huh. I'm going to find that out. I'm surprised. I thought we had closed them. We were just talking about today.
Okay. Well, thank you very much. Oh, go ahead, Commissioner Schrader. Did you want to say something? Oh, no.
You're talking about Milwaukee, and I think what we need to do is to be talking to the city as well.
I am the city.
We are with the city.
You city councilor.
I think we need your help to keep them shut down at this point, because it's probably.
I want to be very clear about this. NCPRD has not shut down their park system. Only the county parks are closed. I got this information from the Clackamas County website. I haven't checked it this morning, but that's what it said at 10 p.m. last night.
Well, I just got an answer back from our administrator that all our parks are closed. So if people are on them, they're not on there legally. I will check with and get some enforcement out there.
Yeah.
Great. And please also make sure that Scott Archer is aware of this, because we have had no communication from NCPRD that the parks are closed.
Okay.
So thanks. I appreciate it.
All right. Thank you very much for that. Again, you can raise your hand on the phone by hitting *9 or just raise your hand in Zoom. The question that we've also got offline: this pandemic will impact the state's economy for at least the next 2 years, if not longer. Similar to the feds, is the state legislature considering an economic stimulus or economic stimulus measures that could create jobs in Oregon?
I will just jump right in then. I think that when it comes to Oregon's ability to spur our economy forward, we are dwarfed by the federal government. We have to balance our budget every 2 years, and the federal government can invest deeply. And when you come to times like this, when you have a national emergency like this, they're able to spend into deficits, and the state is not. I would say that there's a lot that the state can do to provide the ability for businesses to navigate these times. We can ease up regulatory requirements. We can ease up payments. We can pause new taxes. We can pause new programs to put less burden on taxpayers. There's certainly a lot that we can do at a state level. Our state level budgets have grown within the economic boom that we've seen as a nation for the last decade. And I think that at the end of this, as you said, for 2 years, I bet that is probably pretty realistic, that it'll probably take a long time to come out of this. And I would expect that our state government will shrink during that time as we navigate that at a state level. But I think that as far as economic stimulus goes, we definitely have programming at Business Oregon and in other areas of government that we can provide supports to business. Some of that's grants, some of it's low interest, low cost loans. But as far as really stimulating the economy, the people who do that are the optimistic people in this world who start businesses. And they make the courageous decision to go out there and continue to sacrifice and work hard to build something and to employ people. And we can do our part to support that and make that easier. But at a state level, I definitely think that we have fewer tools available to us. but I think we should use every tool that we do have available to us to support our economy right now. Oregon families are struggling when we just get out our jobless numbers and they say 1 in 8 have filed for unemployment. We're all going to feel that. We're all going to know people right now that have been affected by this pandemic, whether or not that's for health reasons or for the economy. And so we're going to have to pull together in the recovery like we have pulled together during this pandemic.
Thank you, Representative Drazen. Representative Salinas, I see you have your hand up.
Yeah, I would just add to what Representative Drazen said. While we are not going to be able to do anything close to what the federal government can do in terms of stimulating our economy, we're also going to be in a position where many of our human services and healthcare programs are going to be utilized more than we've seen in the past as well. So we will be facing this awful, awful predicament where our revenues will be down, folks won't be employed, and so we won't have that tax income base, while at the same time the need for services for TANF, WIC, SNAP, the Oregon Health Plan will be greater than we've seen in recent years. So we are going to be in a really terrible place.
So you guys can't just print money?
We can't. We actually have to balance budgets.
Yeah, it's interesting. We've had the same calls. What can the county do? We survive on property taxes. We don't have income taxes or business taxes like Portland or Multnomah County. We are restricted on urban renewal. So we don't have the resources to do that, to provide support for businesses. We do have some grants that occasionally come, and frankly, we do $250,000 worth of grants every year. But frankly, I think right now it's going to be about feeding people more than anything else, because I think that everyone should be able to eat. But it's definitely challenging. We also have to balance our budget every year, and that's not always easy. And we're going to see our government shrink too, as all governments will. But I guess this is a time when you see how important governments are, state, federal, and local governments to your daily life. But we're going to build Highway 205.
If I may add, from the federal scene here, talks about long-term economic recovery are definitely ongoing. Thinking about what a stimulus package might look like, moving past the virus. So those talks are ongoing, and right now it's first things first, supporting our health systems, getting PPE into hospitals. Providing a safety net for folks who have been laid off and helping businesses stay afloat. But we expect to see hopefully an infrastructure package coming out of this.
Okay, so we've got 3 additional people who would like to give a comment. First up is going to be Bree Sagdal. Bree, you are on. So go ahead.
Hi, everybody. Brianna Sagdal here. Good to see you, Christine. Good to see you, Andrea, and everyone else on the call. I had called last week and addressed this question to Ken. So in regards to using all of our available resources, I am hoping that there has potentially been more conversations around the antibody titer test. Multnomah County Republican Party actually just put out a press release, again, regarding this guidance document that was sent to the CDC and the FDA. We have a clear path forward to getting people back to work, and other countries are using this. Germany, South Korea, for example. I am wondering if there have been additional conversations about maybe even just doing random samplings of antibody titer tests and getting some better data sets for the population of Oregon. Really, if we could, at this point in time, figure out who has already been exposed to COVID-19 and has immunity as we build up our community immunity, we can start getting people back to work responsibly and effectively bringing our economy back to life. Have there been any, conversations about that, and where are we on that?
Okay, thanks for that. I see Representative Salinas, you have your hand up.
Yeah. So I always tell people my two favorite topics right now, personal protective equipment and tests. Those seem to be the questions that everybody most wants to hear about. I have not engaged in any conversations about these antibody tests. I do think, and I literally have this conversation almost daily with somebody either from the governor's office or from OHA around testing, because you are right. I think the more people we can test, the better off we'll be. There is a shortage just generally nationwide of tests. I think Oregon's trying to catch up because we have not tested enough people. And when somebody is exposed, it would be better to know what those concentric circles look like and where that exposure has taken place. But we're not at that point yet. And part of the problem, and I actually was on a call a few weeks ago with Quest Diagnostics and their team when they were opening up a new lab back in Virginia, and they were increasing capability down in San Juan Capistrano around testing. And their biggest hurdle, and it still is one of their biggest hurdles and everybody's, is the supply chain. So just because a lab says they may be able to test does not mean that they actually have the swabs for the collection of the samples, may not have the vessel to put the swab in, may not have the delivery and transportation systems to get the tests to the labs. Then once they're in the labs may not actually have the reagents. So just because we say that we have a certain amount or number of tests available, that doesn't mean that the entire supply chain is in sync with that ability to test. And so there's been a lot of just confusion and miscommunication. And I think even when the idea first started around drive-by tests, I was getting, just deluged with constituent, requests, like, why can't we do drive-by tests? And I said, those don't actually exist. Like, you can't right now drive by in a lot of these states and get a result from a test immediately. I think there's some things have improved now, and we have seen some Abbott, I think, is going to come up. In fact, I think the governor came out with a press release today about some rural areas getting the new Abbott, and I can't remember what it's called exactly, but it's a quicker test. It's like a 5-minute test, which really is a kind of on-the-spot type of testing. So I think that we will probably have this conversation, but we have not had it yet. But I have not personally been in conversations around this, but I would suspect as we get closer to surveillance and trying to figure out how we can start to open things back up. But I think lots of different things will have to be in place. I think the nature of this virus will need to be better known, what its seasonality looks like, whether people build up an immunity to it and whether they can contract it again. So there are lots of things around this, but certainly the ability to test will be one of them. And I do think we have to keep all things on the table at this point.
Okay, thank you very much for that, and thank you very much for the question, Ms. Sagnall. Next, we're going to go to Leah Sundquist. Ms. Sundquist, if you can unmute yourself, because right now, okay, and now you can go ahead and ask your question.
Hi, this is Leah Sundquist. I appreciate you all doing these weekly. I am your OSU County Liaison for the extension. And I just want to let you know from a local perspective, since we are a service district, that although our offices are closed for public interface, we are trying to do a lot of things by providing resources online with the Master Gardeners program, where they can take free courses to try to build gardens for themselves for self-sustainment. We are putting information out on the website for 4-H youth activities for kids and all the different programs. Our family community health program is providing activities, fitness, food hero recipes, resources for individuals who are low income, need to kind of economize, especially right now with no jobs, with SNAP, as well as food preservation information. And we are answering phone calls daily. I have our staff checking phones for messages, and we do have anywhere between 8 and 10 questions a day, besides what our Master Gardener Ask the Expert line is taking in. The other thing that we can do if we're asked is to mobilize our volunteers to help with any face covering potentials. I know I haven't gotten any requests from the Agency Option Center, but there are some counties that are asking voters to do that if it looks like there's a need. So I just want to let you know that 4-H was out there with the 1918 Spanish flu timeframe in Portland, and we are here to help out where you need us to. Thank you.
Thank you.
All right, thanks very much for that. And then we're going to bring in D. Long. D. Long is the handle here. D. Long, if you are there, and you can unmute yourself. Looks like you're still muted, or it shows no microphone. If you are there, D. Long, are you there?
Hello?
There we go. You are on. Go right ahead.
Hi. One of my concerns is I live next to a school, Rao Middle School, and I see a lot of people out there and stuff. And I realize that, you know, people want to get out and move around and stuff. They don't want to be stuck in their house all the time, and maybe they've only got a small yard. But the thing I was thinking about was maybe you could offer people to be wearing masks, you know, even out when they do go to a schoolyard. And the other thing was my two sons work at a retirement home in West Lynn, and we all were sick, really sick. And my son went back to work like 3 days after he'd been sick, and I said, you really shouldn't go back to work. I was worried about, you know, all those old people. And of course he works in the kitchen, so he wasn't really near them, but he had to go to work because he worked a 6 a.m. shift, and they're one of his main guys. Well, the other one ended up staying home a lot longer. I kept pushing him, stay home, stay home. They really wanted him, but I said, you know, you deal with dishes and stuff. I just don't think you should go back to work yet. But some of my other biggest concerns were, I told the kids a couple weeks ago, they really ought to be wearing masks, you know, even when they're cooking and washing dishes and stuff. And they just started it yesterday. So my concern is there's probably a lot of places like, you know, they say to, you know, keep buying from restaurants and stuff, you know, deliveries and stuff, and running through the McDonald's line. I really think those people should be wearing, you know, to protect each other. Anyway, that's all I have to say.
Yeah, we were really short on masks, homemade ones, but somebody donated a bunch to the county and they're accessible. I believe the County Emergency Operations Center may have the opportunity. You know, today, Martha, we have a county partnership in China. And today, Martha's expecting a shipment at her front porch of 20,000. Is that right? Your mic.
Oh, you're muted, Commissioner Shrek.
2,000.
2,000. Oh, that's almost 20.
Oh, there you go.
Anyway, so they're shipping them to Martha, but I don't know if these are certified masks or not, but are they?
I would say probably not. There's like the N95 masks that our hospital systems use, to the best of my knowledge. Mm-hmm. The biggest thing with masking right now is that you're assuming you're infected and that you're not going to infect anybody else. So when you sneeze and cough, you're containing, you know, the spray that you go out when you sneeze and cough. Right now, you know, that's kind of the premise, that you can wear a mask, but you're really not necessarily protecting yourself as much as you're protecting other people in case you have the disease. And the reason I say that is because we do have lots of homemade masks. I have one, and I wore it when I was delivering food to our senior center the other day, as well as my homeless friend. And the bottom line is the technology for the kinds of masks you need when you're a nurse or a physician or a physician's assistant in a clean room with someone who's infected, it's an entirely different technology. So masks do help. And right now I do know there's a number of volunteers out there who are making homemade masks, but you have to assume that you're not spreading the disease yourself. It isn't necessarily protecting you directly from getting it. That's at least what I have found out. So I don't know if that's helpful, but any mask is better than no mask, I guess, is the mantra out there.
Okay, thank you very much for that. In looking at the time, I think we have time for one last offline question. I've read the CARES Act won't provide direct funding to governments with under 500,000 people. Will that be fixed to help counties like Clackamas with fewer?
Right. So that 150 billion is the caller is right about that. Jurisdictions over 500,000 in population can apply directly to the federal government. Jurisdictions under 500,000 go through the state. And so the state will get the balance of Oregon's total allocation, which I think Oregon's allocation is around 1.6 billion total. And so, Clackamas County, cities, other counties will access that money through the state.
Thank you.
Yeah. Okay, great. Thanks much for that. Looking at the time, I'm going to pass it over to anybody who would like to just give any closing comments before we sign off. So just let me know if somebody wants to say something.
Yeah, I just want to thank you and Commissioner Schrader and your staff for pulling this together. I think it really did illustrate the need to have government working at all levels on this, because it is all hands on deck right now. So thank you for holding these weekly sessions.
Thank you for joining us.
Of course.
Anything else?
If I could, just also want to say thanks to the folks who called in and are participating. There's a lot of information out there right now, and just want to, urge folks to reach out to your elected representatives. Our office is fielding a record amount of contact from constituents, and I see both state reps nodding their heads as well. There's, in our staff, we're working hard to get back to folks and to hear perspective and help out where we can. So, thanks to everybody for being on today, and thanks to the county for hosting us.
Thank you. Well, have a great day. Appreciate your time.
Okay, great. Okay, well, thanks everybody, and thanks everybody for all the attendees for watching. Again, this will be archived probably by the end of the day on the YouTube channel with the corresponding FAQ in the days forthcoming. And 1 week from today, the Clackamas County, the full board of county commissioners is going to be holding a town hall open to many topics regarding to COVID-19. We will get information about that on the website either later today or tomorrow. So I want to thank all of our guests again for joining us. Really appreciate it. And thank you for listening. And that's it. Thank you.